Okay, we're recording. Great. Good morning, everybody. John Harris here, managing partner with Fortune Management, and it is my pleasure to have Miss Brooke Middleton with me today. She is an executive coach with Hygiene Mastery, works with practices all over the Southeast, if not all over the country. And what Hygiene Mastery specializes in is clinical hygiene and then just overall practice management of the hygiene department. So really building an effective and efficient recare program, working on co-diagnosis, co-discovery with the hygienist, enrollment, so that we're converting an appropriate amount of dentistry from hygiene to restorative, and just making sure that we've got all the nuts and bolts in the hygiene department in place. Everything is oiled and it is running like a well-oiled machine. So without further ado, I'll go ahead and let Brooke take over, and she's going to be sharing with us today a very unique scheduling concept called ghost hygiene, which is very effective in a lot of different situations, from what I understand, particularly right now with the COVID-19 situation, and we're having to push patients back. We need a place to put them so that we can get them in sooner rather than later, and B, depending on what your hygiene capacity looks like, where do you put the patients, right? And so she's going to walk us through a concept called ghost hygiene, and so I'll let Brooke take it away.
All right, thank you. Good morning, guys. I hope everybody's staying safe and well, first of all. So let's talk about what ghost hygiene is. So ghost hygiene, it sounds very intimidating at first, but basically what it is it's a proactive and managed way to double book your schedule for success. And in fact, instead of using double booking, I actually like to use the word overscheduling instead, because when we hear the word double booking, there's so many things around it that just they interpret negatively to us. So we're going to say overscheduling. So right now, especially, there's several reasons why we would want to implement a ghost hygiene column in our schedules, but for right now, what we're going to focus on is the current situation in our country with COVID-19. So we know however long we've been closed in our offices, we've been rescheduling those patients, and they have to go somewhere. So the thought is, when we come back from COVID-19, how can we rebound from that and be stronger when we come back than what we were? And where are all those patients going to go? So what we know is that even in our regular schedules, even without the COVID-19 going on, we're going to have cancellations in our schedules, because we're dealing with the public, we're dealing with other human beings, and they have things that come up, whether it's, hey, I'm afraid to come to your office because of the pandemic, or hey, my kid's sick from school, I can't come in, I have to cancel. So how are we going to rebound from that kind of stuff? So oftentimes when we have a patient that's unconfirmed on our schedule and we don't have the correct phone numbers for them, or we're, even when we saw them 6 months ago, we had a number, they gave us another number, and it still doesn't work. And sometimes, even though we have those unpredictable things in our schedule, we're still shocked sometimes when they don't show up. So first of all, we want to look at in each office. So ghost hygiene columns are not going to be ideal for every office. So first you want to figure out how much downtime do you have in your practice on your hygiene schedule. So most offices have around 20% downtime. So let's say 25%, meaning you don't have a patient 25% of the time. So, and that sounds like a lot, but if you really go through your schedule and you count how many openings that you had, let's say, not right now, obviously, but if you went back 2 months ago and you counted how many openings you actually have in your hygiene schedule, you'll really be surprised once you actually just put a number on that. So first we want to figure out our downtime. Then we want to figure out how much of a risk are we willing to take in our practice. So, for example, if you have a one hygiene dental practice and you can't really take a lot of risks if you have a one hygiene column. So let's say you have that one hygiene column and we're trying to implement a ghost column. you only have, let's say at 10 o'clock is where we plan for all of this to happen. You have one opportunity for that patient to fall off of your schedule. So you don't really have a lot of wiggle room there. However, if you had a 5 hygiene dental practice and you have your ghost patient over here in your column, then at 10 o'clock, you have 5 opportunities for this ghost patient to fill in your schedule to where you have productivity and you're not down any production there. So let's also say, so with our ghost patient, the way that we like to implement and actually utilize this patient is to think forward and think, how can we strategically place these patients to where it's going to maximize our schedules and be easy. We want it to be easy. We don't want this to be something that's difficult. We're not going to create this column and this fake schedule over here and just let it go and expect the hygienist to deal with it and you know, let it run itself, because it will be a disaster. So with your 5 hygienists and your 1 opening or your 1 ghost patient over here, let's say that we're looking at the 10 o'clock appointment slot, and we've already established at that 10 o'clock we have the risk for 5 openings to come available for 1 patient, right? So if you want to go on a bigger scale, that 1 patient can fill the hour of, the hour before, or the hour after that appointment. So that takes those 5 possibilities of openings to 15. So 1 patient over here in our ghost column has the opportunity to fill 15 vacancies. So when you really look at that, that's, I mean, from having nothing to at least having 1 more patient there gives you a lot more to work with and a lot more to kind of have a little bit more predictability around. So we've already established we want to determine our risk for the threshold and our percentage of our downtime. And you know, a lot of practices, so the practice that I've worked in, we have the possibility, sometimes we have 8 hygienists working at one time. So our ghost column, when we created this, we've actually been using it for a while, and we implemented it for a similar reason. So now that we have the COVID-19 going on and we're restructuring and trying to find somewhere for all these patients, in my practice, the reason that we implemented it was we had a bridge that shut down that was the main route to our office, and it was on an island, and a lot of patients lived in between. We had 2 practices. They preferred to go to the other practice, and our thoughts were, well, we can't see all the patients in the other practice, so what are we going to do? Because if we don't fill the schedule in the island practice, then I mean we're not going to have anywhere to work. So we implemented that, and it worked really well. And in the past couple of years that we've implemented it and that we've used it, we may have run into a pinch with doing this maybe twice. But one of the biggest things around implementing this is what is the mindset of your team? So is your team the team that's going to say, hey, whatever happens, we're going to make it work? Then you probably can handle, you have the likelihood to handle a larger threshold for your risk than if you were a practice with a team that they get bogged down with their obstacles or, you know, something like that. And a lot of our other practices, when you ask them, you know, how did this happen whenever you had 2 patients show up? What did you guys do? What was that like? How was it? What was the pressure? A lot of them will just tell you, I don't know, we just made it work, you know? And that's what's great is when we're able to implement a column like this, it takes it from we're going to double book our hygienist to, hey, we kind of have this overflow column over here that's floating, and it's less predictable than our scheduled hygiene columns. And we're a team, and we're going to look bird's eye view and see where we can make this work. Can an assistant possibly take x-rays for me? Can the office administrator talk to the patient, get them some water, or, you know, seat them in an extra operatory? If you are a practice that does not have a lot of extra operatories and you're only 1 or 2 hygienists practice, you're going to have to be a little bit more strategic with this. If you don't have an extra operatory, this probably is not going to be something that's going to be the most ideal for you. However, assisted hygiene, I mean, some practices don't have many extra operatories and they still can do assisted hygiene in that way. So it just varies per practice and how that can look and, you know, how creative you can be around it. So let's talk about when we come back from the shutdown. So when we come back, we know from the 4 weeks, the 6 weeks, the 12 weeks, however long that we're out, all of those patients, they're going to need somewhere to go. So let's say that we come back to work in 2 weeks. Well, if we look at my schedule in 2 weeks, you know, I'm already pre-booked because we pre-booked from 3 months ago, 6 months ago. So you can do two things. You can take those patients and essentially shift your whole entire schedule forward, or we can talk about implementing a ghost column. So when you actually create, let's talk about the how. When you create this column, it will essentially be an extra column in your software on your computer that it's not assigned to anyone. It will be its own column. This is not where you fill up a whole column of hygiene patients. Again, you're going to be strategic on where you place these. Some offices may have 2 ghost patients, some offices may have 1, and some offices may have 6. It all kind of goes back into a circle on what's your percentage of your downtime and what's your highest volume throughout the day where you have your cancellations. For me, at our office, let's say we had 6 hygienists running at one time, we typically utilized between 3 and 4 ghost patient slots, and that also just depended on which doctors we were working with that day, and their popularity as well as the hygienist. So a lot of factors can kind of play into that. But so when we start to place those patients on there, again, you think about it and you're like, oh my gosh, how are we going to make this work? What if all these patients show up at one time? You want to confirm your predictable schedule first. So we want to confirm John's column. We want to confirm Brooke's column. We want to know of those patients who's coming, who's been hard to get in touch with, what's our wild card, and where do we need to go from there. So let's say our 10 o'clock patient on Brooke's schedule is unconfirmed and it's 2 days before the appointment. So what do we do? So then you start looking over in your ghost column and say, okay, do we have a patient in the ghost column in this morning that could potentially fill in this spot? So you can call that patient 2 days before. I say 2 days before because that gives you a little bit more time to play with versus the day before. And again, you still may have a good bit of change just within the 2 days. You call that ghost patient and if they're not scheduled at that 10 o'clock slot, ask them if they can come at 10. Slide them over into your predictable schedule. And then you want to take that patient who's unconfirmed and put them over into your ghost column. So let me show you guys. I do have a representation here. So here's what that might look like. So your left message here at 10 o'clock, we can swap that with our ghost patient. And let's say we have the left message over here on this schedule at 4, swap that with our ghost patient. And now we have 2 full predictable schedules. You're going to put those left message patients over here in your ghost column. And what you're going to do is you're going to call them whenever, probably, give them that day to call you back, call them the next morning. Your conversation with them is going to change. It's going to sound probably something like, hey, John, this is Brooke. We're reaching out to you. We've been trying to get in touch with you. We need for you to call our practice immediately. We've not been able to get in touch with you to confirm your reservation, and we'd like to find a day and a time that works for you. So you are switching that conversation from, hey, we're calling about your reservation to, hey, we need you to call us immediately because we haven't heard from you. You've reserved this appointment, and we need to find something that works, that that is going to work, and it's going to be predictable, so we know that you're going to be there. And let's say that that patient doesn't call you back, because how many times do we go throughout our day and hear those patients say, oh, well, you know, sometimes I get 10 or 15 text messages or emails or phone calls from the office, and I was just assuming that they were just reminding me again of my appointment. I hear that a lot sometimes. So with those patients, if they do show up that to that appointment at the same time, first of all, you're going to clear in your morning huddle that day. Your hygiene coordinator or someone who's going to be overseeing and facilitating that ghost column is going to clear in your huddle, and they're going to say, hey, we have a potential pinch that could happen at 10 o'clock this morning. If this does happen, how can we make this work? And the whole team is sitting there, and you guys are going to talk about, hey, assistants have this chair open at 10 o'clock or at 10:15 if the patient can wait, or however that looks for your practice. Being able to clear that and facilitate that first thing in the morning is going to be what saves you if that happens. Now, sometimes when those patients show up, they may say, oh, well, if I have to wait, I don't want to come back. And then it's like, oh, you know what? You don't have to wait. We already have a chair. We're going to get you over here. Nicole is actually going to help Brooke out, and she's going to assist you until Brooke can come over to you, or whatever. But when that patient shows up, your verbiage to them can be something like this. John, oh my gosh, I'm so glad to see you. I was so concerned. I've been trying to reach you, and I haven't heard from you in 6 months, and I thought that you moved. I'm glad to see you. You know, we're going to get you worked in, figured out, however you want to word it from there. But, you know, so that kind of, and a lot of times those patients will look at you and say, you know what, I did get those phone calls, and, you know, like I mentioned earlier, I didn't think to call back because I thought that they were just reminding me of my appointment. So a lot of times patients, you know, it's not going to be, like I said, it's not going to be a full column where you're going to have to worry about, you have 2 hygienists and now we have a 3rd full column. It's just going to be staggered, you know, in there, just a couple of appointments that are going to help you out through your high volume throughout the day. And most of the time it works itself out because we do, and especially right now with everything that's going on, I think that we'll find when we do come back to work, you know, that those patients who are either they're sick or, you know, hey, I've been off work for this long and I can't really take any time off for my appointment right now. You know, we're still going to have those unpredictables and those unknowns. So how can we strategically work around that? And this ghost column is an awesome way to do that. So anyone have any questions so far?
Let's see if there's any questions in the chat box.
I don't see any questions. That's good. And so Shannon and myself and Kim did a video. It's on our website about this, and it goes more into depth just about, you know, how to calculate if you really want to put a figure on how much you are losing by having whatever percentage of downtime that you're having throughout the year, throughout the month, and things like that. You know, we have some pre-recorded video that goes into a lot more depth about that, and it's really eye-opening because your 20% doesn't seem like a lot, but when you actually put it on paper and put numbers to it, it can look like a very large paycheck that you'll be missing out on. So as a hygienist, I have been working the double, you know, doing that, working the assisted hygiene, accelerated hygiene, however you want to phrase it. It is a scary concept at first, until it happens. And I take the mentality most of the time that it's going to work itself out, because I know that I have a great team that's going to help me work it out. So it's typically not that big of an issue. And, you know, as far as handling it and rescheduling a couple of days before, you have a little bit more of a heads up to be able to plan around those wild cards and what could happen here and what could happen there.
Yeah, so my fear is a lot of people, like early in the call, you mentioned double booking. And in my experience, I work with a lot of practices in the Southeast too on the fortune management side. And, you know, a lot of people hear that word double booking, and we're looking at the practice more from a global standpoint, an overall business standpoint. You dive deep into the hygiene department. And so we play in that space a little bit. And anytime you hear the word double booking, everybody's defenses go up. Right. So I want you guys to know that Ghost Hygiene is not just blindly double booking patients and then running the risk that you're going to have two patients show up at the same time. And now you've got to explain why this patient's appointment is no longer available. This is a very strategic, very managed, and very controlled process. So you're really mitigating and minimizing the opportunities whereby that would ever occur. And Brooke, I think you said you run 8 rooms of hygiene.
On some days.
Yeah, 8 rooms of hygiene on some days. And over what period of time did you have those 2 occasions where you had a little bit of a patient issue?
Within 8 months to a year. So it's not, and again, a lot of folks, when we explain this, because it does seem so far-fetched, and that's why I did want to give a slight visual. You know, you don't have a ghost column for every hygienist. You have a ghost column for your hygiene department. And it's not a column that everyone in the office says, oh, there's an empty hygiene slot, let's plug in a patient there. You know, that's not how it's going to work. It's going to work in a way that, so let me touch back on this too. So you don't just put any patient in that ghost column, because those ghost columns I call it a sacred hygiene column. Don't mess up my sacred hygiene column. But you want those patients that are going to go there are not your, I'm a Brooke only patient. If I come in and I'm on John's schedule, I'm going to be very upset and I might leave the practice. That is not the patient that you want to put in that ghost column, with the chance that they may end up seeing another hygienist. That would be an absolute no.
And not the patient and not the patient that can only come in at 10 or only come in at 2 or 4. You want somebody with maximum flexibility in their schedule, like a
retiree. Exactly.
Yeah. Okay.
Exactly. And that was my next point too. That's a great thing with the retirement. I was going to go more for maybe it's the businesswoman or the businessman that has, you know, they don't really know what their schedule looks like that far in advance. I mean, a lot of people don't, if we're being honest, right? Yep. You know, and maybe it's, well, you know, you look back at their history. I mean, look forward, plan ahead, look back at their history. Do they come at 2 o'clock every single time they come with this certain provider? Do they kind of come at all different times? You know, and sometimes they'll tell you, hey, you know, if you have something sooner, let me know. These are those patients, you know, that are, you know, I love everybody. I just love coming to the office. I love my doctor. And some will tell you, hey, as long as I get to see my doctor, I don't really care. Mm-hmm. And those are fine. Another thing to caution you on when thinking about implementing this, if you have a great periodontal program in your office and you have a good bit of periodontal maintenance patients, you want to be very careful with putting those in that column, because with those patients, you really, really, really want to build that value and that rapport with their hygienist so that they understand and have that relationship and help together, because they've gone through the treatment, they're in the maintenance phase. So you want to be careful with those. If I do put a periodontal maintenance patient in that schedule, it's probably going to be one that, you know, we've done their therapy. I just can't connect with this patient. I can't establish great rapport with this patient, and I think that they'd be better with someone else. Or, you know, maybe they're just stone cold towards you and kind of shut you off, and you're just not getting the interaction and rapport there.
Yeah. Plus, I would think putting a perio patient in that column would give you less flexibility. A, because the length of the appointment's different, and you don't have as many of those perio blocks in your schedule. You got a lot more recare blocks than your perio blocks. What about new patients? I think I know the answer to that question, but would you, if you got a new patient that's, you, for whatever reason, you had to schedule them out a week and they want to get in as soon as possible, would you take the risk of putting a new patient in that column?
I probably would not,
Mm-hmm.
because the last thing that you want to do is for that day, every single patient confirm, and you have to call your new patient and reschedule that new patient.
Right.
I mean, there are situations where it might work out, maybe, and again, a lot of new patient appointments are different than just your standard pro-fee appointment. So that would be kind of a wild card too, and again, there might be some days where it might work out to where you had 2 patients fall off. I just think it would be a lot more risky putting a new patient there.
Would you recommend to give the office a little bit more flexibility? Would you recommend creating some consistency between the length of a perio appointment and a new patient appointment? So for example, a lot of new patient appointments are 90 minutes to 2 hours, and so are your SRP appointments. And if they're the same length, then you could potentially, it gives you some more options to where you're not just limited to perio blocks, you're not just limited to new patient blocks. Now you've got, so if you have a new patient, if you've got, let's say, 8 rooms of hygiene and 1 SRP block per day on all 8 columns, and 1 new patient block on all 8 columns, and you have one perio patient in the ghost column, now you've got 16 options.
Right.
I'm saying if they're the same length.
Right. So I wouldn't recommend putting any like SRP or anything like that in your ghost column. Again, because let's say, John, you're a new patient in my schedule and we hit it off great. We both love football, baseball, and we're excited to get this thing rolling to start on your periodontal therapy. The last thing that I want to do, I've enrolled that treatment and I've built the value on that. And the last thing that I want to do is to have you see a stranger, especially when we're talking about the seriousness of gum disease and things like that. So I would only in this column, just your basic pro-fee patients mostly. If your office sees kids can go there. Most of the time kids don't really care unless their parents care who they see. So that's kind of what I would steer towards. Again, mostly because even with your periodontal maintenances, even though they're usually the same length of time as your pro-fees, you still want to keep those with that provider that established and that had created that connection. Creates a lot less stress and hassle on the patient if they were to be juggled around, and it's easier to look at, okay, there's a 1-hour slot here. What can I do with this versus, okay, well, there's 2 hours here. I could take this patient here. Does that make sense?
Mm-hmm. Would you recommend having a hygiene assistant?
I have a hygiene assistant, and I love having a hygiene assistant. I feel like there are really great benefits to having a hygiene assistant, and I think that also some offices function better without them. In my office, our hygiene assistant, because we have up to 8 hygienists, our hygiene assistant is very busy. So if you have a practice that you have a good bit of hygienists, or there are several pinches within your day, just on a normal day, where you can justify having a person there that will help ease that, then yeah, I mean, I think it's a great thing to have. Now, if you are a 1 or 2 hygiene office and everything runs smoothly, you're on time every time, you don't have to worry about sharing x-ray sensors, you know what I mean? Everything's predictable and flows smoothly. I don't know that you would get the benefits fully. It is great when you start doing things like, let's say your hygiene department does, you try to do same day services. Hygiene assistant is great because they can, hey doc, Brooke is gonna actually do some periodontal therapy today. Can you be ready for some anesthetic in about 20 minutes? And that's less time I have to take away from my patient. to coordinate that behind the scenes. So there's a lot of pros, and there can be some cons, just depending on your practice too.
Okay. One other question that came in here was, will this be available on Facebook? I won't have it available on Facebook. I possibly can. I would have to get Shannon Richkowski's permission and Brooke's permission to do that, but it will definitely be uploaded onto my YouTube channel. And so if you need access to that, I've got that uploaded on there along with a variety of other of these calls and educational programs that we've been doing over the last couple of weeks. I would also encourage you to go to the Fortune Practice Management corporate YouTube channel, because Shannon Richkowski did a video on ghost scheduling, last week, I think. And it was a really good one too. I saw that one, and that's what inspired me to Brooks my my local hygiene mastery expert here in the Southeast. So when I saw that video with Shannon, that's when I reached out to Brooke and said, hey, we need to do something similar to this. When are you available? So it will be available on the YouTube channel. And if Shannon grants me permission, if Brooke grants me permission, I'll absolutely upload it onto our Facebook page too. Okay. Any other questions? And we'll get them. If you've got any questions, please drop them in the chat box. We'll go ahead and knock those out. And if not, we'll let you guys get on with the rest of your day. Kind of an open forum here. So if it's I'm prepared to answer any COVID-19 paycheck protection program questions and any of that kind of stuff. There's been some recent updates to that program. All right, my lady, looks like we're all clear. So guys, if you guys need anything from us, please, Brooke, how can they get in touch with you? I want to reach out to you and have a conversation with you. How can they get in contact with you?
I can type my email address right here in this chat box. Also, you can find me on Facebook. My email is simple. It's brooke@hygienemmastery.com, and it is Brooke with an E, because everyone likes to spell it without, which is fine, but for this, it actually matters. So I will type it right here. So if anyone has any direct questions, you can email me and I can get back to you on those.
Yep. And someone asked about CE. So email me directly. You can email me at John Harris, Jon Harris @fortunemgmt.com. Or you can even, I think you can even reply to the constant contact email that you got. Just reach out to me directly and I'll send the CE over to you. And Brooke, I'll send it to you too, so you've got it in case anybody asks you for it.
Okay.
And even though we only went for 35 minutes, I think I blocked this thing off for 2 hours because I didn't know how deep a detail we're going to go into. But between us, actually, I won't say this on recording because I don't want to get in trouble, but you'll know what I'm talking about on the CE when I send you the CE certificate. So we'll say that. All right, it looks like we're all clear. Guys, thanks so much for joining us this morning. If you got any questions, please feel free to contact myself or Brooke. We're here for you guys to answer any questions or challenges that you're running into. Until next time, y'all have a great rest of your day and stay safe and healthy.
All right. Thanks, John, for setting this up. Thank you guys for hopping on.
Yes, ma'am. You're very welcome.
Bye.
Bye.